been delivering these workshops for about 11 years. I have been completely inspired by the wisdom and the kind of approach that this program takes.
Self-management programs, chronic disease self-management education, CDSME. 6-week programs designed for adults with chronic conditions or their caregivers. There are a variety of program types that focus on specific conditions or populations. For example, diabetes, cancer, pain management, caregivers, people in a workplace setting, etc. Participants work towards self-identified goals and learn strategies and tools to self-manage conditions or stressors due to the conditions.
It emphasizes people's innate desire to feel better, to have a better life, no matter what their life circumstances are.
Benefits of the CDSME programs. Participants learn to eat well and manage weight.
I am somebody that lives with diabetes, and prior to the workshop, I really did not have any control of my condition. Then once I became employed with doing this type of work, I bought into the program that actually changed my life and it helped me control my condition. Hence, 13, 15 years later, I no longer use, I'm not on medication. It's managed by healthy eating and exercising, which is one of the pillars of the program.
Benefits of the CDSME programs. Participants learn to set goals for improving their health.
Each week builds on itself, both from a content standpoint and from building a community in a safe space, and that makes it very powerful, not only for the participants, but for the peer leaders.
I absolutely love walking through and teaching people how to action plan. I love decision making. It just really helps people see the process in which they make decisions. They get to write their own story. They get to write their own success.
I feel like sometimes when people are registering to become a peer leader, they think they have to know everything, but you're their peer. You don't need to know everything. You're going to get taught all the tools that you need to provide with everyone, and you practice them all in the training.
In many other patient education programs, you're seen as the subject matter expert or the person with all the answers, and in this program, you're not.
Benefits of the CDSME programs. Helps participants cope with pain, fatigue, and stress.
You're really just there to facilitate the process so that people can try out new skills and new what we call self-management tools to help them manage their chronic condition better. You present the tools to people, you present the environment, which is a safe, non-judging environment, and you let the program do the rest. You let the process do the rest. So I really like that because I don't feel the pressure of, having to know all the answers.
Modeling is a big part of both being a peer leader and being a master trainer. We model all of the activities the way we're training them to lead the program.
As peer leaders, we are peers. I found that my own health conditions have improved and that the techniques that the chronic disease self-management program offers and trains people in are invaluable.
In your last session of your class, everybody says what they've accomplished during the workshop. And it's one of my favorite parts because as they're going around, almost all the participants share things that you didn't even know that they were achieving. You never know what impact you are making on them, and that it's so powerful.
It's a very self-empowering type of program. We don't give you answers, we motivate you to seek those answers. And I think that's probably one of the key points in terms of this whole self-management aspect.
Benefits of the CDSME programs. Participants learn to effectively communicate with their doctor.
As a peer leader, I see that tremendous satisfaction. I see people who don't know anything about these techniques, and then they're like experts at it at the very end. We ask them, how did you change? How did this workshop impact your life? And people will come back and say, I no longer eat junk food after dinner. I drink a lot more water. I feel more confident in how I communicate with my healthcare team.
To learn more about becoming a peer leader for the CDSME programs, contact the Evidence-Based Intervention Team at the New York State Office for the Aging, NYSOFAEBI at aging.ny.gov.